Dr. Baliga here. I have another terrific podcast for you, the Must Know EKG podcast. You'll find this podcast educational, like all other podcasts in this Must Know EKG series. This podcast is derived from EKGs available at mastermedfacts.com. A 17-year-old presents with palpitations. Looking at this EKG, the most likely diagnosis is 1. Atrioventricular nodal tachycardia, AVNRT. 2. Ectopic atrial tachycardia. 3. Atrial tachycardia. And 4. Ventricular tachycardia. This EKG is courtesy of Dr. Joseph Marine, MD, cardiac electrophysiologist and Vice Chief and Vice Director at the Division of Cardiology at Johns Hopkins in Baltimore. And the answer is 1. AVNRT. Atrioventricular nodal reentry tachycardia, AVNRT, is the most common type of reentrant supraventricular tachycardia and arises from a level above the bundle of His. The substrate for AVNRT is the presence of dual AV nodal pathways, the fast pathway and the slow pathway, which are both in the right. Like most SVTs, the QRS complex in AVNRT is usually narrow, that is equal to or less than 120 milliseconds, reflecting normal ventricular activation through the His-Purkinje system, although aberrant conduction, example underlying bundle branch block, can result in a wide QRS complex. The P wave that occurs after the QRS complex, and therefore there is a short RP interval. This is an example of another AVNRT, and you will see in lead V1 the P wave is present soon after the QRS complex. Although AVNRT was originally described as being confined within the compact AV node, whether some atrial tissue is part of the reentrant circuit remains unsettled. AV nodal reentrance is characterized by a narrow QRS complex and a P wave occurring simultaneously with the QRS complex during tachycardia. Reentrance utilizing a concealed extranodal pathway was characterized by young age, absence of organic heart disease, fast heart rate, presence of bundle branch block during tachycardia, and a P wave following the QRS complex during tachycardia. This concludes Must Know EKG podcast. Follow me on Twitter at RR Baliga MD.